Welcome to the Geriatric Dietitian, your go-to resource for nutrition that supports health, independence, and confidence in aging. I'm your host, Katie Dodd, registered dietitian and geriatric nutrition expert. Let's dive in. Hello and welcome to the 17th episode of the Geriatric Dietitian Podcast, Maintaining Good Oral Health in Older Adults. So we are on our final episode of a 5-part series that we've been doing all about oral health in older adults. Now, over the last 4 episodes, we've covered a lot of information. We started off talking about why oral health matters and why I always say the mouth is the first route of nutrition. We talked about dry mouth and how it's something as simple as saliva plays such an important role in chewing, swallowing, tasting foods, protecting our teeth, keeping them healthy. We talked about missing teeth. We talked about dentures, chewing difficulty. We talked about how wonderful dentures can be when needed, but they're never quite the same as natural teeth, and how tooth loss is not a normal part of healthy aging. Then finally, in our last episode, we talked about how poor oral health can contribute to things like malnutrition and even increased risk of aspiration pneumonia. So today I want to bring all of this together and focus on something practical. What can you do to maintain good oral health as you age? Now, I want to emphasize here, I think this should be clear, but I am a registered dietitian and I am not a dental professional. I have really made it a mission to continue to further my education, go to trainings, learn about these topics, but this podcast is never a substitute for individualized, personalized medical care. So be sure to work with your primary care team. Be sure to see a dentist, see a dental hygienist regularly for cleaning, and I'll always defer to the professionals when it comes to this space. But I still want to have this conversation about good oral health from the perspective of a dietitian, because if oral health is bad, it will contribute to poor nutrition, poor health, all the things. So let's dive in. The good news is that many oral health problems are preventable, and small habits practiced consistently over time can make a tremendous difference. So we're going to start with the basics, but I also want to acknowledge and respect that many of you have lifelong habits. And I can be here on a podcast saying, oh, how easy it is, brush your teeth twice a day. I recognize that it can be so hard to change our habits, so hard to change lifelong habits. But my hope with this series that I've really driven home why these things are important. It's not just about brushing your teeth to avoid a cavity. It's about brushing your teeth to save money, to preserve your health, to maintain your nutrition, to save future costs down the line. So I just want to acknowledge, it may seem like, oh, this stuff is so simple, but I'm just recognizing that it's hard. There's a reason why a lot of people struggle with poor oral health. But when we start with identifying why it's important and we really commit to making the change, we can start with small changes. So I'm going to list lots of things. Maybe you'll pick up, I'll do this one thing, or maybe I'll do a few things, but just know anything you can do to improve your oral health is going to matter. So first on our list is brushing your teeth twice a day with a good fluoridated toothpaste. So if you're not brushing your teeth at all right now, maybe start with once a day. Twice a day is the goal, or even better yet, if you're able to invest in a nice toothbrush like a Sonicare or an Oral-B, that's really going to help you with brushing your teeth, especially if maybe you don't have the strength and dexterity that you used to. But if you invest in something fun like that, you actually might be excited of like, oh yeah, I'm going to go brush my teeth. I'm going to go use this new fun device that I got. I just bought my daughter a Oral-B toothbrush and she's so excited to use it every day. So, brushing twice a day, really important, but even buying a good electric toothbrush, which is probably going to work real nice and efficient, better than sometimes what we could do on our own. Next on the list is something a lot of people skip: floss every day. I mentioned how I worked in home care for 13 years, and I would always ask my clients, do you brush? Do you floss? I can't tell you how seldom it was to encounter someone who flossed. It was very, very, very rare. And almost every time I encountered someone who flossed, they had all of their teeth. So that could just be a reminder too of flossing is important. And to help you improve your flossing, have floss on you. Like if you like to hang out and watch TV in the living room, have it on your table or your nightstand at bedtime, have it readily available. You're going to be more likely to floss if you have it somewhere. Whether or not you like string floss or even the floss on the picks, there's lots of different options out there. So I know that flossing isn't everyone's favorite activity, but cleaning between your teeth removes plaque, and from places that your toothbrush simply can't reach. And also, we often get things stuck in our teeth that can inflame and cause issues for our gums. So flossing goes hand in hand with brushing teeth, and these daily habits are some of the best things that you can do to protect your teeth and gums. Now, if you wear dentures, you need daily care too, okay? A common misconception is once someone has dentures, they no longer need oral care, and this is simply untrue. Because dentures collect bacteria like natural teeth, food can also become trapped underneath them. It can cause sore spots, irritation. Dentures should be removed and cleaned every day. It's also important to gently brush the gums and tongue and roof of the mouth. We're still providing that oral care and taking good care of dentures to keep your entire mouth healthy. Next is don't ignore dry mouth. We talked about this a few episodes ago, but saliva does so much more than what people realize. It helps us to chew, to swallow, to taste food, but it also helps to protect our teeth from cavities and gum disease. That saliva is important to keep things moving so, stuff doesn't stay stuck on our teeth and contribute to dental caries. So if your mouth constantly feels dry, bring it up with your healthcare provider or dentist. Sometimes there's medications that are contributing to it, and maybe there's some strategies your healthcare team can come up with to help you to alleviate your dry mouth. Simple things like sipping water throughout the day, chewing sugar-free gum if appropriate, drinking fluids with meals, and keeping up with your dental care can all make a big difference when it comes to dry mouth. Now, nutrition also plays an important role in oral health. Eating balanced foods, a balanced diet, provides nutrients like calcium and vitamin D and phosphorus, different nutrients that support healthy teeth. At the same time, limiting sugary foods and drinks can reduce your risk of decay. One of the big things that we often see is when people sip on sugary drinks throughout the day, they're continuing to expose their teeth to sugar versus having a beverage that doesn't have sugar. Or if you're going to drink a sugary drink it in one setting, go brush teeth. Get all that stuff off there. Just small things can protect your teeth over time. Now, another very important habit is seeing your dentist regularly, okay? This is one of the best ways to prevent major dental problems is to catch them early. Regular cleaning, so cleanings every 6 months and dental exams can identify cavities, gum disease, and other concerns before they become really big problems. And earlier treatment often means less pain, lower costs, and long-term outcomes. Now, I do understand not everyone has dental insurance, but there are programs available for people who are low income. There are programs available at local dental offices where you could pay for memberships and pay a low monthly fee and get your cleanings and get your exams. And I do understand, sometimes money's tight and it's like, oh, where should I spend my money? I'm trying to make sure I have enough money for food, but looking into your community resources and trying to figure out what are the resources I have available. If I can't secure or I don't have good dental insurance, what are the other ways that I can get care? I know for me, I went through a season of a couple years where I didn't have dental insurance, so I didn't go to the dentist. And in retrospect, I didn't realize how many local offices had programs available where I could pay out of pocket, either at a lower rate or a monthly fee to allow me to get those regular exams. So remember, even if you don't have dental insurance, there are still ways to meet your preventative dental needs. And I guess another thing I want to acknowledge, I feel like so much of this episode, let me just acknowledge this. I know it's so easier said than done, but I often think that some people avoid the dentist because you might know that you have poor dental habits. You might know that I probably have cavities and I'm so scared about what the cost is going to be. My biggest advice to you is just bite the bullet and do it. If you suspect you have cavities, okay, they're just going to reinforce what you might already know, but they're going to be able to do things to help prevent more cavities from happening and help you to create a treatment plan to start slowly tackling away the issues you have. So if you have that feeling in your gut of I just don't want to go to the dentist, I hear you. But also, the mouth, first route of nutrition, such an important part of our overall health. And honestly, I wish that dental care was incorporated into overall healthcare. Dental care is healthcare, but I often get frustrated when dental care isn't covered under healthcare insurance. And it's a separate whole pocket, and a lot of people avoid getting dental care. So I also want to speak quickly to caregivers who might be listening. If you are caring for an older adult with dementia, Parkinson's disease, arthritis, weakness from a stroke or other condition where brushing can be difficult, they may need your help. I know as a caregiver, there's so many things on your plate. It could be easy to forget, like, oh my gosh, I need to make sure that I'm helping with flossing every day. I need to make sure that I'm helping them with brushing every day. Sometimes it might be as simple as a reminder, like, for example, someone with dementia, reminding them to brush, maybe setting a timer so they know how long before they stop. But other times, it might be setting out the toothbrush. It might be modifying a toothbrush handle to make it easier to hold so that way they can get back on all those spaces. And other times it does physically mean helping someone to brush and floss if they're not able to on their own. So good oral care is important for caring for someone's overall health. And I just want to say one more time, I recognize that taking care of oral health isn't always easy. Dental care can be expensive. Many older adults don't have dental insurance after retirement. Medicare covers limited dental coverage. Even transportation to the dentist can be difficult, especially if you're homebound and can't drive. Others have dental anxiety that keeps you from scheduling appointments. And these are real barriers. So it is important to acknowledge them. So if this is your situation, don't give up. Just start with a small step. Maybe your small step is scheduling a dental appointment you've been putting off. Maybe it's asking a family member for help finding a dentist that has a program that you can afford. Maybe it's looking into community health centers, dental schools, other local programs that offer lower cost dental care. Again, maybe it's simply buying like a fun new toothbrush and some floss, maybe an electric toothbrush that'll make brushing more exciting. Small steps really do add up over time. So let's wrap up this series. And one message that I hope that you continue to remember: the mouth is the first route of nutrition. Taking care of your mouth helps you to continue to enjoy the foods you love. It supports good nutrition. It helps you to preserve your independence, reduces the risk of malnutrition, can even reduce the risk of aspiration pneumonia. And good oral health is about so much more than teeth. It's about protecting your overall health, maintaining your quality of life, and preserving one of life's greatest joys, and that is enjoying a meal with people you love. So thanks so much for joining me on the series related to oral health in older adults. I hope that you learned something new and feel encouraged to take one small step towards bettering your own oral health today. So if you enjoyed the series, I'd love it if you could subscribe to the Geriatric Dietitian Podcast, share these episodes with friends, families, caregivers, and together we could help make sure that more older adults are staying healthy, strong, and independent as they age. So until next week, take good care of yourself and don't forget to brush and floss. I'll see you all next week on the podcast. Bye. Want simple nutrition tips to support healthy aging? Download my free guide, 10 Essential Nutrition Tips for Healthy Aging, packed with practical ways to stay strong, nourished, and independent as you age. Grab your free copy in the show notes or visit thegeriatricdietitian.com.